So as we move towards a loosening of restrictions across BC, it must be said the COVID-19 pandemic, far from over. The BC government announced its plans to reopen the economy slowly. We're moving into phase 2. But researcher Sandra Isaac says we must all continue to practice physical distancing and ensure cases of COVID-19 do not reach carrier and secondary communities or any Indigenous communities for that matter, as it could be devastating. Isaac looked at the history of pandemics in member nations. She again stresses the importance of social distancing, physical distancing, self-isolation for some, hand washing for sure in the months ahead until a vaccine can be found. And she joins me this morning. Good morning.
Good morning.
Yeah, so basically you had the task of kind of poring over all this other research. Can you explain what you did?
Well, yes, it was actually quite a quick study.
Mm-hmm.
The CSFS called me and said, could you do a quick research on the issue of pandemics in our communities, especially in the case of the smallpox, because that had a pretty devastating impact on our communities because we had no immunity, and with the newcomers, the Europeans coming in, we were defenseless in a sense. Right. So we lost many communities, and I think what Warner had in mind at the time is that we should use this as a parallel, if you will. The smallpox in particular has been one in our communities that has still resonates with the people. There's still concerns because historically they've lost so many people. Right. In some instances, whole villages. So, so if we draw that parallel and use this information wisely, and then we suddenly realize there's this global interconnectedness. That's what's happening now. So the approach, it's makes you wonder about isolation. And I think in our case though, with First Nations, because a lot of us are in remote and rural communities, we could almost use it as an advantage, I think.
Isn't it strange? I was thinking the same thing because I saw what Haida Gwaii did, where they literally cut off
access. There's many communities that did that.
They did that, and they had, in a weird way, based on kind of what happened to us, it kind of flipped the script. It has turned into an advantage where we've been able to keep COVID-19 out of communities simply because of the way communities have been not so much designed.
Exactly. I mean, before, it was the intention behind reservations was to isolate us from the rest of society. That was the initial. So somehow this works in our favor. Yeah. And it would be nice, it would be to our advantage to see that advantage. And we do have the power to cut off access to our communities because we are rural. I am concerned though about the more urban.
Absolutely.
Yeah, I mean, they'll have to find creative ways and then just stick to what's working, which is self-isolation, social distancing, and we have to be paranoid about washing our hands.
Absolutely. Well, I was thinking like you mentioned the smallpox, but even like that the influenza was it 1918, 1919. It was global.
That was global, yes.
But then the number of fatalities, when you look at Indigenous communities, non-Indigenous communities, it was something like 8 times the amount of fatals in our communities. It's still, I mean, all these diseases have had a disastrous impact on communities. No?
Oh, they have. You'll see, but the interesting thing that comes out of that, the list, if you will, of these pandemics, worldwide pandemics, is they've all been caused. They're not, it's not some conspiracy theory like in the case of smallpox. Yeah. That was real. There were infected blankets. People wanted our lands and our farm, because we had some great. We always chose well. Like in our communities, we always lived by the river or the most fertile land. We knew the land inside out. So of course, the Europeans, the settlers, when they came in, they were vying for these lands. And of course, it's a sad reality, but A lot of people didn't care about inoculations for smallpox or, that sort of treatment. It was available. Some people escaped through isolation. Like there's one example was Metlakatla. The Metlakatla people wanted to move from Lakwalams, from Port Simpson, in the 1860s. And they were so fortunate they left just before smallpox, the second wave, I think, had hit, or the first wave. And they escaped and they were saved. But unfortunately, the ones that were left at Lakwalams, a lot of them perished.
Right.
And then I think Duncan, though, he did some inoculating.
Right.
But they were spared. And it's just, and they were moving to actually they called it Old Metlakatla. It was an ancient village, and they just wanted to go back. And isolation does work as well.
And it's so strange, you hear people now, despite, hearing and learning about smallpox and the influenza in 1819, that people think COVID-19 may be a hoax.
It is not a hoax. It's a real, very dangerous disease. And it was caused, unfortunately, by these wildlife markets. And most pandemics were actually caused, the interconnectedness between these
species, right?
These species and humans. And it's poor populations as well that they resort to this because that's all they know and they have to make a living. So in order for this to change, I think that has to be addressed. They have to close these markets because this is all the way from China and it's affected the whole global community.
When I think about things like swine flu and H1N1 and all these, you think our whole relationship with animals in general probably should be re-examined.
Exactly. Well, I'd love to say we should all become vegetarian, but
no,
I can't.
No.
I can't do it.
No.
But of course, our people eat but we're very careful and we don't mess with the laws of nature. We would never eat a bat. So, and I think our people also traditionally, we knew what self-isolating was. We'd remove ourselves from the community. Carrier Sikani in particular, for instance, if a young man or young woman went on a vision quest, they self-isolated. They seek their vision and did their sweats and stuff. So we're used to that. It's part of our culture. And I think that could be stressed in the communities. And then food sovereignty comes to mind with this whole pandemic, because if you grow your own food, it's safe. It just goes on. It's got this ripple effect, I think.
I've talked to a number of people who look at this pandemic as they see this big crisis. But I mean, even in business, when people, there are many types of people, they view crises as big opportunities, right? We're now seeing the gaps, and we're also now realizing the dependencies that have been created. We've been legislated away from being able to harvest. We've been rules set up that prevent us from hunting and gathering.
Yes.
And then we're seeing, it's almost like pulling back the rock and seeing the kind of what's wrong that we accepted over a long period of time. But here we are in a crisis saying, oh, wait a minute, do things actually have to be this way?
Exactly. And we know we've got the traditional knowledge. We've got, and the other thing I always maintain that we have is not just our resourcefulness, because we are a resourceful people, but we've got that survival gene in us all. And I think, we're used to crisis. So I think we're better equipped than probably most people to handle this pandemic.
There was also the fear that some people might not be taking COVID-19 that seriously. They look at the death rates, and then there's that dismissive attitude. Well, it's people that are old, right? Like this whole, it's a really bizarre, twisted thinking that, and I've heard it from people I know, you see it in media, but that now we can just dispose of people that are over 65. This kind of bizarre rationale, and we're putting this idea of economy before people. What do you think about when you hear people say these things in a pandemic like this?
Oh, well, it with our people, we revere our elders and our children, and we always take care of them. I mean, in any situation, but more so now, we have to protect them. They're the most vulnerable.
Mm-hmm.
And I see these old, most of them have passed away in old age homes.
Yeah.
A lot of our people, they stay in in our communities, and sometimes we're fortunate enough to have, an elders care facility.
Yeah.
And that helps because our people can speak their own language, and they don't have to feel isolated or threatened, as they get older. And we should just continue to care for them,
okay.
as we always have. And they're the knowledge keepers.
That's what I was going to say. What do we lose when they're gone?
We lose a lot. We lose language, the transfer of knowledge, because traditionally the role of elders was always to teach the young children, right? As they're growing up. And this was done through storytelling and how to respect one another. And it's built into our system, into our botlat. So I think we've got all of that. We were always self-governing. But I think with the stigma now attached to, you're saying, some young people saying, well, it only affects the old. No, it affects everyone, actually. No one's immune.
Yeah.
So.
And why is it important to look at past pandemics to inform what we do today, do you think?
Well, because we were always the most vulnerable. Now, when I look at this list, like the Russian flu, the Spanish flu, the Asian flu, the ones that affected us the most, though, however, were like the swine flu, SARS, and of course COVID, and the smallpox from the last century. So these numbers affected us from the smallpox on, the H1N1. It did have an impact on our population. But with this one, I think we can do better because of this isolation and social distancing. It's harder in our communities, though. This is what concerns me, is in a lot of our homes, there's overcrowding.
Yeah.
Poorly built, bad ventilation. So that concerns me. So this is where if we need help from the outside, this is where it should be addressed.
Right.
I think. Yeah.
So that's the thing. Once it gets into community, we look at what's happened when it's got into long-term homes. You get into a community where you got housing where there's overcrowding.
Everybody would be affected. And that's what's so scary about it. So we have to actually really work on prevention.
Right.
And I think that's the key.
Right. And speaking to carrier communities right now, what message would you like to share? Take
it very seriously. It's real. Worldwide, it's worldwide. It's not just affecting us. Smallpox affected us. We felt, it affected us more than anyone because we had no immunity and it was a new disease. With this one, we have some control because of the isolation and remoteness of some of our communities. We can bar people from coming into the communities and infecting us. But in the meantime, we have to take this seriously as well. And it's real. It can affect us. We have to wait for, what is it? I was going to say inoculation. Vaccine.
Yeah.
The vaccine. Mm-hmm. So, and that we have that's about a year away. They're saying there may be a second wave. So this is the time to get the message across, because right now they're opening up the province. So we're probably saying to ourselves, oh, well, we don't have to worry as much.
Yay. But that's saying like, oh, wait, hold on.
But I think it's the businesses and, the markets that people are more concerned about. Plant your own food. And this could be a reset button for all of us.
And support those elders.
Take care of the elders.
Absolutely.
And the children too. They're vulnerable as well.
Right.
Well, we're all vulnerable. So we have to keep washing our hands and just
trust in the experts.
And we have to continue to respect Mother Nature and respect the laws of nature that carrier Sekani people have always lived by. And I think that's the important message.
Well, Sandra, thank you so much for joining me, Miss. I really appreciate it, and we'll also make sure to make available the research you did, and also all those links you provided as well, so people can look and read for themselves. And we'll keep on this because, like you say, this is going to be happening for a while. And I think it's just to just keep reminding people. And I also like to say I do applaud the people that have been practicing physical distancing. I think
there have been a lot of them. I've been reading. Yes. It was great talking to you today.
We'll talk to you again.
Okay. Bye-bye.